is most important.
Well, welcome, guys. And again, thank you so much for coming online tonight. And again, for your time, energy, and effort for making it onto this call or listening to the replay. If you're on the live call right now, hit that share button, guys, because we have Dr. Sunny on from the beautiful UK, where it's 21 degrees and it's the middle of summer. Well, welcome, Dr. Sunny. And again, thank you for taking the time to come and have a chat with us.
You're welcome, Robert. Thank you. Thank you. Looking forward to getting grilled with questions, as we spoke about earlier.
Look, we're going to have a really good chat. And guys, it's about 20 minutes that I want to have a chat with Dr. Sunny. You do run a very successful clinic up in the UK or in the UK. Dr. Sunny, what you just were talking about, could you give us like 2 minutes of that again, of what you do in practice, so that people understand exactly who you are?
Okay, so for me and my mission for adding value, it's about adding value to patients' lives. And the way that I've chosen to do that is by using aesthetic treatments, supplements, and skincare. And that's my platform to try and help empower people. So patients come in to see me and they might be coming in because they're not as confident as they want to be, or there's something not quite right and they want to discuss it. So by helping them through with aesthetic treatments, supplements, skincare, and also wellness as well, looking at them from a medical point of view, from a preventative way, we can empower them. I can add value to their lives so that they lead a more productive life. And one of the mantras that I have is that if you're leading a productive life yourself, you can then help people around you. And for me, health and wealth are so intricate and entwined with each other that I was searching for something, something for in clinic. And that's why I'm, amazing platform today. And thank you for inviting me. Zinzino for me has been a platform to help empower patients so that they can connect with their future selves, so that, in 20, 30, 40, 50 years time, they're still living a productive life, they're still confident, and they look and feel their best. So that, that's our mission statement in clinic. That's my mantra. And Zinzino has been one of the platforms that has helped me achieve that, give people evidence to say that this is what you need to do, or this is what you want to do.
Let's talk about that for one moment, because that's my mantra as well. My number one priority that I say to everybody I talk to, and they say, well, why Zinzino? I go, well, look, the products are outstanding, but what we've got is we've got this incredible balance test that holds the Amiga industry accountable for the inferior products they sell on a daily basis. Now, and I know there's a lot of Amiga products out there. It's one of the largest categories, platforms. But to have this access, or have access to this test now, and there's like 701,000 people that have been tested. So does it work? Categorically, yes, it does. Okay. How do you use this in clinic? How are you finding this as that first approach to allow you then to move them onto the Zinzino products? Then we'll start talking about the Zinzino, but the balance test always fascinates me on how our wellness professionals are getting great results with their patients by having the blood analysis in front of them. Talk to me how you implement it.
So the thing is with a medical model, so for those who don't sort of know what a medical model is that in medicine, when you're trained as a doctor, you go to medical school, and a lot of the stuff that we do is reactive. So someone comes in with a problem, and then we do a test, and we diagnose, and then we treat. So the great thing about the finger prick blood test, or the Zinzino balance test, is that it fits in with that kind of traditional way of approaching medicine. So that's good for me as a doctor. Patients recognize that, clients recognize that. They have a test, and it gives them a physical idea, it gives them a measure. And we are, as humans, we are very data driven. That's why social media and all the things that we spend all our time on now is so successful. We're data driven. We want to see evidence. We want to see the before and after, whether it's aesthetic treatments or whether it's blood tests. So there's a great lead in for the balance test. It can give you physical proof. And then, humans are always, they're questioning. And I encourage questioning for my patients. When they come in, they're like, well, this balance test, what is it going to show me? Well, it's not only going to show you, it's got evidence behind it. There's 500,000 have been done worldwide already. So you've already got a data set for more than 500,000 test subjects. But it's going to give you an individual result. It goes off to a lab. We can follow the journey of that balance test to Norway. to Vitas, which is independent. And that test that comes back is not just a generic test, it's actually showing you what's going on within your red blood cells themselves. And that's where this was an eye-opener for me in terms of balance tests. Normally I'm used to doing a general blood test, it's a plasma test. It shows you a snapshot in time. So, if you get your cholesterol checked, say, for example, if you'd had, a heavy meal the night before, your cholesterol potentially, a plasma test is going to not be great. But what the balance test is actually showing you what's been going on for the past 3 months. And I always relate it back to a personal journey. My balance test, I'm going to cringe when I say it, I think it was 24 to 1. I'm a doctor. I'm meant to embody health and beauty and confidence. But when my balance test came back, it was 24 to 1. It opened my eyes, because it was all the sad faces. It was all in red. But within 4 months, it had dropped down to, I think, 4 to 1. And then within 6 months, it was 2 to 1. But the health benefits I'd already experienced. So, better normal brain function, normal heart function. I felt a difference in my recovery when I was, when you're 14, you've got young kids and you're having to run behind them whilst they're learning to ride a bike. You don't want to be huffing and puffing. And my recovery from just little everyday things was amazing. And that's what I relate to my patients. This is a test, 500,000 tests worldwide, a great data set, something you can do in the comfort of your home. You don't have to actually come to clinic. Especially during these times of COVID and people's worry about coming into public places. So that was my lead in, and that's how I sort of encourage patients to start the Zinzino journey with the balance test.
Perfect. Look, and the balance test, guys, again, it's your own analysis of your own blood, your own DNA, basically. And again, if you're taking in an Amiga product, we can scientifically prove, okay, or as I say, hold the omega-3 industry accountable for the inferior products they're selling. So that's the importance of step one. This is a must, okay? It's a must to do that. Then,
Robert, I'm always a stickler for words. So just for anyone, afterwards, we don't want any DNA comments. So remember, with that blood test, it's measuring the profile of your omega-6 to 3 ratio across your red blood cell membrane. DNA, it doesn't do those. I'm sure those tests will come in time from Zinzino. We're always innovating, but for any of you that are gonna, I know colleagues will be watching saying, "Oh, you mentioned DNA, but does it test DNA?" Well, it doesn't. It's a red blood cell, and it measures your omega-6 to 3 ratio across that cell membrane. But you can extrapolate that to every single cell in the body. It's not just your red blood cell that has that omega-6 to ratio. Your brain cells, your liver cells, heart cells, everything. So skin, muscle, bone, tissue, everything in your body. It's a measure of that.
See, guys, that's an amazing learning curve that you've just got there. And again, that's why we have scientists on and doctors, not salespeople, okay? I need to be just cuffed up now. But I agree with you, okay? And again, I very rarely say that, and I don't know why I said that, but I said it. But
we're just in the flow. We're just in the flow.
The clarification's good. And why I like you guys telling me that, hey, let's just get that right, because we have to be right in what we're saying. You have to, it's so critical, okay? That with the analysis that we do of the Amiga systems, it's critical that we have that test and we are saying the right things out in the world. Again, we are not doctors, okay? And I keep on telling people I'm a salesman. I'm not a scientist, okay? And I'm proud of that, because my job's to get, again, the test and this into as many bodies as possible. Like your mission, Dr. Sunny, you want people healthy. The same as me. In 22 years, I've been doing it continuously. The louder I can keep yelling, okay, the better it is for people, because they're starting to listen. And, love or hate the COVID scenario, but I've called it a blessing because, from my side, everybody's concerned now. Like you said, the heart, the brain, and immune is why they want to get on this incredible balanced oil. Let's talk about that, okay? So first up, the Balance Plus, so the standard balanced oil, and then the one with the high polyphenols, okay? That's 4 times the strength in polyphenols. Can you have a quick chat about where you see them playing in field at the moment for you?
So for anyone who's watching now, I give my opinion and I try and base that on as evidence, but for anyone that has time, you should just go on I'll say, well, Amazon or wherever, any good online bookstore, but that means Amazon basically, but Dr. Paul Clayton. You know, Dr. Paul Clayton, if you really want to understand what is going on with these ingredients that we're talking about, he has an amazing set of books that, you know, I've read cover to cover, and I repeatedly read. And if you look at the books I bought, there's notes in there, you know, look at this again, look at the evidence, and it's all referenced. But I have a great story that actually, to be fair, to give Dr. Paul Clayton his due, he's the one that told me this, and it's a personal one, and it resonates. And I think it will resonate for a lot of people because you guys are in, you know, across Australasia. It's a big place. And one of the questions about polyphenols was that, you know, for my ancestors, they come from a central landlocked place, Punjab in India. You know, fresh cold water fish was not available. And why are polyphenols important? They're so important because they get that omega-3 into your system. They protect it, they coat it, they get it through. They not only keep it preserved almost within the bottle itself, but once it's out on the spoon and you take it in and you swallow it, it carries it through the digestive tract, and it helps to get the omega-3, which can sometimes be a bit fragile in its structure, into the cells that need it. So polyphenols are plant-based carriers, and the reason why I brought up the India story is that for generations, my ancestors would have eaten foods that are rich in polyphenols. But as time has gone by and a modern Western diet has come into play, those polyphenols have been extracted from our food. They've been taken out because actually, you know, they're expensive. They're fresh plant-based molecules that actually almost degrade food sometimes in a way. And they're expensive. So modern food manufacturers have taken those things out, and then that prevents some of those new micronutrients from actually getting into our body, the nutrients that we need, like omega-3. So for generations, my ancestors would have eaten foods that are rich in polyphenols, spices, Indian spices. You know, the picture is, you know, if you think of India as in food markets, you know, mountains and mountains of spices, and think of those as polyphenols. And what Zinzino have done is taken those polyphenols, put them in and bound them in with that omega-3 so that it helps get that omega-3 into the cells that need it. And that's every cell in your body. So if anyone's confused about what I'm going on, because I do ramble a little bit, polyphenols are plant-based carriers, and they're so important because they've been part of our diet for generations. But the modern Western food manufacturers have extracted those, you know, got rid of them, and what you're ending up with is nutrients that are not getting into the body. And so what Zinzino have done is taking an excellent source of omega-3, bound it up with polyphenols, which are from olive oil, you know, going back to the idea of the Mediterranean diet. And they're taken from immature olives so that they're very rich, they're not refined in any way, bound it to that omega-3 so that when you ingest that omega-3, it's actually getting into the cells that need it, because those polyphenols, think of them as carriers. You need something to carry that fatty acid into the cell, in through the body and into the cell, and that's what it does in a nutshell. So I've got it's going to sound weird, but a very close relationship with polyphenols, because you know, we don't cook like my ancestors did, and what I have now every morning is a spoonful of balance oil, and I know that I'm getting those micronutrients where I need them.
Look, and that's the key that we've got here, okay, and especially in Australia, you know, we've only got, you know, basically the core products, so the balance test and the Zinzino balanced oil. That's the beginning of our health protocol. 2 weeks ago, we got the premium balanced oil through. So again, if you haven't tried this in Australia, please try it. We're very, very fortunate about Doc Sunny that up in Hong Kong, China, we do have the full health protocol. So that's my next step. And again, Hong Kong, China, our sales volume is going crazy, okay? The growth, like 400% last month, you know, the millions and millions of dollars being transacted in this region, just on the balanced oils and the balanced test. Hong Kong, China, which has got the extra products, are seeing unbelievable results. Tell me about what you do with the Xenobiotics, the Extend and the Viva, the next steps of the health protocol.
So, I mean, the health protocol, that sort of golden triangle of balance oil, Extend, and Xenobiotic is, you know, it is the kind of gold standard. It's what we'd like all our patients to go on. But sometimes, you know, people are reluctant in the terms of it's something new. It's something that I always get questioned, well, why isn't my GP spoken about this? Why isn't my consultant in hospital talking about this? Because when we're medics, we're trained to be reactive. You know, this is a new concept for me in the past few years about preventative health. And so my answer to patients and clients is, look, we don't necessarily get taught this approach because we find it difficult to connect. You know, when you're healthy and you feel healthy or you feel well, you're not going to connect yourself to your older, unwell self. But by the time you get there, it's a little bit maybe too late. It's never too late. You can always make changes. But, you know, we want to get there before there's a stroke or there's the onset of, you know, memory loss or dementia or all those things that we worry about when we start to feel signs of it in our 40s and 50s. But even then, we just don't make that connect. So xenobiotic, let's focus on that first, Robert, because xenobiotic was a new concept to me. A prebiotic, like everyone's heard of probiotics, right? We've heard of, you go along the refrigerated counter in any supermarket and you see all the little bottles of probiotic. I was like, well, what is this prebiotic? You know, where does that come from? Well, think of your stomach or your gut. So, you know, your whole digestive tract as a war zone. And again, I borrowed this from Paul Clayton, so, you know, credit due. Think of your digestive tract as a war zone. Now, when you take a probiotic, you're sending in fresh recruits. Okay, these fresh recruits, they're grown, you know, they're loving, tender care in nice steel vats. Never known a problem in their lives. Think of those are your fresh recruits, these little probiotic bacteria, and then you throw them into a war zone. Like, what do you think is going to happen to those poor guys? They are just going to get annihilated, and maybe some might survive. Out of the millions and millions that you send in, you know, a few might survive. But think of your gut flora, the flora, the commensals, the friendly bacteria that are already there. Think of them as your veterans, your hardened soldiers. Imagine sending them food parcels. Like, how happy would they be? You know, when I was on deployment and I got food parcels or little parcels from people back at home, it was amazing, and it drives you, to work that little bit harder. So imagine your gut flora is like your hardened soldiers within your digestive tract, and you send them food parcels. Not only they're going to multiply, not only they're going to become more diverse and stronger, and that's going to strengthen you overall. So probiotics have a place, like, don't get me wrong, probiotics have a place when you're unwell and you've been on antibiotics. There's evidence to show that if you take a probiotic, and for example, I'm going off tangent, but for example, for menopausal women or postmenopausal women, taking a lactobacillus probiotic is important, but feed your soldiers that are already there in your gut. Because remember, your gut, 70% of your immune system and your nervous system is actually in your gut. We keep thinking about the brain as the leader, but more and more research is showing that your gut is actually comprising 70% of your nervous system. So when you send those food parcels into your little soldiers, you're actually educating them with beta glucans. They're getting a whole education in there. Not only are they getting food that they want to eat, you know, you're not feeding them with processed material. You're feeding them with something that they're missing, and they have been missing probably for years, because that's what the modern food industry has taken out of our food. So xenobiotic is your food parcels to your gut, and it educates your gut. And by educating your nervous system, you're also educating your immune system. You're saying to your immune cells that are within your gut, you're saying, look, this is what you should be doing, and you shouldn't be causing problems for your own cells around you. So this is where we get into a little bit of gray area, and we have to be very careful. You know, beta glucans, there's proven evidence to show that they can educate your own your gut and strengthen your immune system. And what xenobiotic is a prebiotic that's high in beta glucans, which are derived from oats. And I'm happy to be corrected afterwards on comments and things, which is, it's gluten-free essentially. So that's fine for patients who maybe have a gluten sensitivity. I'd be careful with patients who have celiac, start them off on a lower the recommended dose. But your xenobiotic is a way of educating your gut, and it's feeding those poor soldiers that are in there to strengthen them, they can multiply. And what we find with xenobiotic is that sometimes people do get, they feel a bit bloated initially. or they might have some feelings in their gut. And you know what? That's your normal gut. Like your normal gut should be making noise, you know, and not to, I mean, it's late now, so I'll say it, you know, passing wind is normal. Having that sort of little bit of bloating, that is your gut starting to digest and have a natural production, as it would be. Okay, I'm choosing my words carefully.
Yep.
So prebiotic, xenobiotic is very important as part of this kind of approach. And extend is a hard one because I can't show you a picture, but I'm sure Robert can put it later. Is that I present my patients with a picture of all the micronutrients they should have. And I was like, look, if you could spend days shopping for all these micronutrients, but what Extend contains is micronutrients like zinc, magnesium, beta glucans again. You know, it's a whole A4 size of a diagram is the best way to describe it. That's what I show in clinic. And if anyone wants it, I'm sure Robert will help. But it's a way of getting your micronutrients. And it's, again, look, we call it a golden triangle for a reason, because that triangle is strengthening it. It's being strengthened, and that's you as a person. Balance oil that's high in omega-3 and polyphenols. Your xenobiotic, which is then strengthening your gut, and then in turn your nervous system, your immune system. And then your Extend, which is providing micronutrients, which you just wouldn't get on your average shopping trip, unless you shop for days in food markets, which I know doesn't happen anymore.
Yeah.
I'll stop talking there. I'll pause for breath.
And now the Viva, okay, the Viva, obviously, when you start looking at the Viva, the sleep patterns and the results we're seeing there as the final part of that triangle. What have you seen?
So, I mean, I put Viva at the heart. So because we've run out of points on a triangle, obviously we only got 3. Yep. Viva is the heart because, again, it's a bit of a personal one. I don't mind sharing because that's what people relate to. You know, I went from a very stressful, high impact job in the army. You know, I used to deploy with infantry battalions. So they were, you know, I won't bore anyone with war stories, but, you know, it was a stressful job. But actually, when you're working even in a small clinic and every patient that comes to you, whether it's for aesthetic treatments or supplement advice, that in itself, you know, I take that stress on board and I empathize with those patients. So I don't take Viva at sleep time. It doesn't help me sleep at all, but it does for some people. Viva for me, the saffron extract, I find personally works within 20 minutes. If I'm doing facial rejuvenation, if I'm doing injectables for clients, I will take some Viva because it gives me a little bit of clarity. It just helps reduce anxiety. Now, my anxiety is not, you know, it's not chronic, but in those situations where I'm empathizing with people, I'll take on some of that anxiety, you know, the sort of the worry, because we do medical treatments in clinic and I want to be 100% delivering the best I can. And Viva is at the heart of that. When I took it for sleep time, it probably did help, but I find it works best in the morning or in the afternoon. Instead of having coffee now, what I'll do is I'll take some Viva and I just get that nice balanced feeling that I'm ready to tackle anything that comes into clinic.
Yeah, look, and I'm the same. I take mine around 6 or 7 o'clock at night time because I find if I take it at midnight, you know, type thing, I'm just wide awake. So it's my second kick. And again, guys, all of these, you know, nutrients, you've just got to get your body to sort of tell you when is the best time to take them, okay? There's no right or wrong time. It's how your cellular structure can absorb them. They do all work synergistically together. That's the core thing here. The way Dr. Paul has put the program together, that triangle all works synergistically together. Okay.
And then for those sort of science nerds out there that want to, you know, it's like, hang on, I've never heard of saffron before for treating anxiety. If you Google saffron or Afron and anxiety, the number of published papers is, you know, there's a huge list. You could spend weeks reading them all. And this is really important before I start to counsel patients on a supplement, because we're not using it to treat anxiety or depression, but what it can be is a very good adjunct for helping people who whether it's sleep problems or whether it's a little bit of, you know, intermittent kind of heightened awareness or anxiety that feelings or a generalized feeling that, you know, you're not quite sure what's right, you're on edge. There's plenty of scientific published papers, peer-reviewed papers out there that support the use of saffron and Affron as a means of helping with supporting people with a little bit of anxiety or sleep.
And look, and Dr. Sonny, I say that about the Amiga products as well. People say, well, where's your double-blind studies? I go, well, let's put it this way. You know, there's so many studies out there with Amigas, okay? Now you've got a formulation that categorically works, and you can do your own double-blind test, okay, on yourself, okay? So you take a test at day 1, take a test at day 120, 240, 360. You can test yourself continually to see that your Amiga product is working on you. There are so many studies on the products, okay, as on Amiga, that you can go and pick any type of, you know, disease that's out there, and Amiga's being the baseline normally does assist in some way with the result of getting better with that disease. So it's quite interesting, like what you said. Yeah, there's so much.
I mean, we're always careful on how we approach this, because we have to. So I mean, I've done the search, and this is the questions that I asked Dr. Clayton before I even started on this journey. I was like, well, hang on, Dr. Clayton, I've been to medical school, I've been a GP, and you know, these double-blind studies with omega-3s, they're a little bit, they're ambiguous, they're not clear-cut. And the issue is that not all studies are created perfectly. So one of the things that I always say to patients is, look, you've got to question everything. If you come to me with a question, I'm not going to say, oh no, it's written on the packet. I'm going to absorb that question. I'm going to say, well, okay, I'm going to find out. And before I went on the Zinzino journey, I said, what are people going to ask me? What is a negative view of these products? And omega-3s, you know, people have their negative views, have positive views. But the point is that you've got to question what you're reading. You've got to question after this, you've got to question everything in your life. You've got to challenge the rationale of someone else's view, and you've got to make it personal. So what Robert has said there for everyone watching is that, look, it's a personal journey, because at the end of the day, we've got one life. Okay, you're not living your life for other people. You should be living your life for yourself, because it goes back to an analogy of, you know, you're on an airplane and the oxygen masks drop down. You don't give the oxygen mask to the person sitting next to you or to your child or to your partner. You take the oxygen first, you live, and then you give oxygen. And that's the same with any health journey that you're taking. Question, understand, form your own decision, not other people's views. And then once you've made that decision, then you'll be like, I'm 100%. Now I'm living my best life. And that's what the journey was for me for Zinzino, is questioning and saying, well, I need to formulate my own opinion. And one of the things is that, you know, this takes 4 months to see the results.
Yeah.
You know, if this was something that you just took one spoon today, and then tomorrow morning you wake up as a superhero, as a Marvel character, then, you know, bless Orlan and Zinzino, you know, everyone will be doing it. But it takes time, and it takes a consistent approach. You've got to make these little steps every day. It's that one spoonful or 15, 12 mils, whatever the average is, the Zinzino balance oil. You're taking it every day, and then eventually you'll start to see the changes, and then you can see that change in your balance test 4 months later. But by the time you get to your balance test, you've already realized that actually I've got some normal brain function back. I don't walk into a room and forget what I'm doing. You know, my clarity is better, my creativity is better. This is my personal journey. You know, my drive is just better. But actually, all I've returned to is a baseline. All I've done is come back to normal, because I wasn't at normal. I was way below. 24-1 was my result when I first did this. Shocker.
And we find that with a lot of people, okay, and we know 95-97% of the world is out of balance. When they do see their initial results, and again, people have, results like yours, and then they see unbelievable results. I was the same. I came in at 7.8, my first test, okay, and then I'm floating now 1.7 to 2.1, which is in the perfect zone. Everything else is sort of, 100 or 90%, and all green happy faces everywhere. But I know my core system, the core program internally, is working at its peak performance now, which is what I want.
Exactly.
You know, and it's like you. I want to spend, you know, and I'm 58 now, 59 in October the 18th. Okay, so you know, I'm 59. I've only got another 40 years if I want to be 100. Okay, so I've actually lived more than half my life. So I don't want to be one of those people in those wheelchairs, as you know, with, you know, stuff dripping out of your side of your mouth and not knowing anybody. I want to be life full, vibrant, and active until I go. And I see that by the way I've been able to preserve and make sure my inner self is, you know, operating at a high level, and it's you know, as clean as possible internally. You know, with the arteries and the cellular structures and all that. Very, very important to me. And like you said at the beginning, people have to take a responsible drive to their own health. They have to become responsible for their health. And it's a little bit like, you know, what we've got going on around the world at the moment. You know, the first list thing is the immune system. It's your responsibility as a person to get your own immune from where the test says 0, 10%, 20%, okay, up to 90 or 100%. And when I got my first one back, I looked at it and went, that's it. I'm hitting this thing hard to get all my results up in this report that I see. And that's why I say to people, you know, your immune system, it's your responsibility to do it. Your medical practitioner will help you with your heart and your brain function. Again, they're going to just prescribe exactly what you've just said, or some other effective products as well. But the core products are what we're talking about, that health protocol. Listen, we've run out of time. We're about 5 minutes over, but I'd like you to give me a 2 or 3 minute closeout. If you're just giving some open advice, okay, without any claims or crazy stuff, on where you think people should be knowing what's happening globally, what they should be doing on a daily basis just to, and we've covered a fair bit of the information, but if you can just give it to them in bullet points so they can go, yep, got that, I'm doing that, yep, I'm doing that. Just a 2 or 3 minute closeout would be fabulous.
No problem, Robert. So I'll be succinct. So I'm going to go hard in with facts. Look, average life expectancy for men is about 75 in developed countries. And that average life expectancy has not improved over the past 20, 30 years. In fact, it's kind of stayed stable. Women live for a bit longer. And my goal is that, look, we've only got one life. There's no sequel, depending on which religious beliefs you're from, but there's no sequel. Okay, there's one life, and you've got to question the status quo. Just because something is put in front of you, you've got to question it. And for me, with improving your health, is you've got to connect to your older self, whether it's 75, 85, 95, or 100. And what you've got to do is then take responsibility, like Robert said, and you've got to look at what's available. You've got to look at the evidence, question it. And for me, Zinzino forms that as a foundation, whether it's balance oil, whether it's Xenobiotic, whether it's Extend. I think you've got to take responsibility for yourself so that you can help the people around you. If the most important thing in your life is your family and your friends, take responsibility for yourself and you'll be able to provide for them in the future. So for me, I want to live the best I can and do the best I can so that when I'm older, I'm not going to be a burden to other people. In fact, I'll be able to help more people. So that's me in a nutshell.
Fantastic, Dr. Sun. And again, thank you so much. Guys, just as we wrap out, okay, and I love doing this at the tail end because a lot of people say, well, you know, just refresh me on what I need to be taken. Just give me the bare facts. Tell me what I've got to do. The guests that are watching the replay, guys, just connect with whoever's invited you onto the call and make sure you get these products into your house as quick as possible. Number one is you got to make sure you get the Zinzino balance test. That's your number one priority, that you get the test done. Once you've completed the test, they will show you the oils and the balanced oil available in multiple flavors and also in a water-soluble base called the Aqua X, if you prefer to have it as a water-soluble. We do have our Premium Plus model as well. So this oil here, 4 times the strength of polyphenols in the Balanced Oil Plus. An incredible product. Again, I've been taking this 2 weeks now. I have been consuming the normal product for about 2.5, nearly 3 years now. I have to tell you that I can feel the next level with the Balance or Premium Plus. Mind blowing. The other products that I say to people you must get is the rest of the health protocol. So the Zinzino, Xenobiotic, the prebiotic, and then the Extend, the multivitamin, and then the Viva, which is your happy pill, basically your saffron or Afron product. You couple all that together and you've got yourself the health protocol, or as Doc Sunny said, the triangle, and put Viva in the middle for the heart. That will give you an incredible dosage of the best nutrients that synergistically work together internally in your system to give you the best cellular result that you're looking for. The person that in what we call our on-the-ground countries, so for an example, Australia, Hong Kong, China, Malaysia, then we go over to India, then we go up to Europe, then we go to UK, over to Ireland, then we go over to North America. This is a package that's available. If you're in one of the pre-launch countries like Philippines, okay, you can just buy a basic kit for a personal consumption model. Here in the rest of the world, we have what we call a Premier Kit. In this Premier Kit, which the person will share with you, is for your brain, heart, and immune system. And you get the balance test in there. You get your first 2 months supply of product. And again, you can choose your flavor. What you will be asked for is like when you actually get a phone or a utility bill or Foxtel or one of those connections, you'll be asked to do a subscription. So on a monthly basis, you'll be asked to buy one bottle of product as your maintenance program to go with your purchase of the original Premier Kit. If you're wanting to become a partner, by all means, talk to the people about, we are very, very much a customer-focused program. Over 400,000 customers now that consume the products on a daily basis, reorder the products on a monthly basis, and we have about 20,000 partners that are out there sharing the good word and connecting customers to our e-commerce platform. As I said, we've over 700,000 balance tests, so you're not the first person we're asking to take an Amiga test. We've done it over 700,000 times previously through an independent laboratory in Oslo, Norway. As I said before, Doc Sony, we're doing great around the world, double digits growth numbers. Zinzino as a company is truly going through the roof. People are starting to see this product and saying, hey, I love this product, and we're getting great results from it. In closing, I want to say thank you very much for coming online. It was an absolute pleasure to have you, just to have a chat with. Every 3 or 4 months, I'd love to invite you back on.
Of course, I'd love to.
This doctor series that we do in a 4-week platform. And next week, we're an incredible lady that specializes in sleep patterns and sleep, okay? So registered nurse, Catherine Nixon from Sydney, Australia. Incredible. Just look her up, guys, for next week. Amazing, amazing lady. And she'll be talking to us about sleep patterns and nutrients and balanced oil as well. Dr. Sunny, again, thank you for your time, energy, and effort. Appreciate you coming online. And thank you to everybody that's come and listened tonight or today, wherever you are around the world. Or if you're watching the replay, hit that share button as well and share it with a friend. Thanks, guys. Take care. God bless. Thanks, guys.
Thank you.